story that came out on CNN September 25th, 2018. Syphilis cases in newborn babies reach 20-year high, CDC says. Congenital syphilis cases: when a mother passes syphilis onto her baby during pregnancy or delivery, have more than doubled in the United States since 2013, according to a report released Tuesday by the U.S. Center for Disease Control and Prevention. 8 out of 10 pregnant women who have untreated syphilis will pass it on to their babies through the placenta, and this can lead to stillbirth or death of a newborn in up to 40% of infected pregnancies, according to the CDC. The number of recorded cases swelling from 362 in 2013 to 918 in 2017. The report indicates 5 states, Arizona, California, Florida, Louisiana, and Texas, accounted for 70% of the cases, according to the CDC. Additional cases were reported in 32 states, primarily western and southern states. Wow, really? Wow. What's going on in the western and southern states? The overall increase in congenital syphilis outpaces the national increase in sexually transmitted disease overall, the report indicates. Diagnosis of preliminary and secondary syphilis in most infectious stages of the disease increased 76% in the US from 2013 to 2017, the CDC reports, though rates of syphilis accelerated most among men, who accounted for more than 88% of infections in 2017. Does that mean the men are heavily sleeping with each other? I'm just wondering. Rates among women are also rising. The report found that 2.3 cases per 100,000 women in 2017, which rose from 1.9 cases diagnosed for every 100,000 women in 2016. 1 in 3 women who gave birth to a baby with syphilis in 2016 did get tested during pregnancy, but either acquired syphilis after the test or did not get treated in time to cure the infection in the unborn baby, according to the CDC. Not surprising. Dr. Pablo J. Sanchez, a principal investigator in the Center for Prenatal Research at the Research Institute at Nationwide Children's Hospital, said, "I'm not surprised that congenital syphilis has increased because we have been seeing increasing cases of childbearing ages. So it's not surprising, but it's of major concern." Sanchez, who was involved in the CDC reports, explained the untreated syphilis in pregnant women not only leads to possible fetal death or death in the first month of life from overwhelming infection, but it can also cause enlarged liver, enlarged spleen, rash, abnormal bone inflammation, and infections of the brain and of the eye in an infant. The majority of babies who are born to mothers with untreated syphilis look well at birth, and that's why it's important to screen women during pregnancy to detect the infection, said Sanchez, who is also professor of pediatrics at the Ohio State University College of Medicine. While some infected babies who go undetected at birth will develop signs of the disease in the first several months of life. Some newborns will not develop any symptoms. Detection happens much later, usually around the age of 8 to 10, but up to 16 years old, when congenital syphilis affects other body organs, causing hearing loss and eye problems, Sanchez explained. You know, no defense, but I'm just getting a feeling that a lot of this is tied to drugs. I'm just saying, some of you might not agree, but I just feel that a lot of this, especially sexually transmitted disease, we know a lot of people have sex for drugs in this country. The good thing is if we are able to identify them, even those who are asymptomatic, and treat them in the newborn period, it seems like these babies do well, Sanchez said. Okay. He noted, though, that we don't have a lot of information on neurodevelopmental outcomes. That's the knowledge gap today. The CDC recommends that every pregnant woman get screened early in her pregnancy so that she can get treated and prevent fetal infection and possible stillbirth. In areas or states where syphilis rates or congenital syphilis rates are high, women should get screened repeatedly at 28 and 32 weeks of pregnancy and at delivery, in addition to early term screening. Yeah, I would agree with that. Since it's so hard to predict what stage it will show up in, that probably is the wise thing to do, especially if the person is abusing a lot of drugs. You would think that that would be the thing to do. Just keep treating them and keep testing them for syphilis. The treatment for a mother with syphilis is penicillin, which is cure active and safe for both mother and fetus. In cases where the mother has not been treated or not adequately treated, then the baby can be treated either with a single shot of penicillin or a 10-day course of the common antibiotic. Yeah, well, I guess in a way they better be glad it is syphilis because, gonorrhea has now become resistant to all antibiotics now. So it's really hard to treat gonorrhea opposed to syphilis. Wow, there's so many things happening now. It's not even funny. But please tell me what you think, ladies and gentlemen, about all of these babies now being born with syphilis. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. Peace, family.